Hi, my name is Amanda. I'm a St. Thomas University nurse practitioner student. Today I have my patient Edna here, and we're going to be doing our cardiovascular system assessment. The first step to assessing your patient is performing vital signs. Prior to coming into the room, we have performed vital signs, and they're all within normal limits. The number one thing that we would do is just assess our patient, make sure they're not in any distress. We would be looking at her carotid as well as her jugular vein area within her neck for any visible pulsations, which she doesn't have. And from her right side, I will ask her to turn left, and if there's any apparent JVD distension, which would be significant in patients with CHF, and which she does not have. Next up, we're going to be auscultating. First thing we're going to auscultate is her carotid. And we do that with the bell of the stethoscope. Okay. And there are no bruits present, which would be a sign of stenosis. Next up, we're going to palpate her carotids one at a time just to make sure that the brain is getting adequate perfusion. Thank you. Okay, next up, we're going to listen to our heart sounds. In the second intercostal space, we have our aortic valve, and also our pulmonic valve. At this point, we're listening to S2 is louder than S1 because it's the farthest point from the heart. Next up, on the third intercostal space, we have Erb's point. That's where S1 and S2 are equal. Fourth intercostal space is your tricuspid valve, and that's where S1 is the loudest. Fifth is your mitral valve, and S1 is the loudest at this point. And right below, we also have the apical pulse, which S1 is the loudest. You also at this point want to ask your patient to lean forward so that the heart can be closer to the chest wall. Thank you. That completes our cardiac assessment.